A very good morning to one and all gathered here. Fundamentals of Nursing Department, along with first year BSc and GNM nursing students of Lakshmi Memorial College of Nursing, are glad to observe World Hepatitis Day. I bid a very warm welcome to all the delegates who took out their valuable time and joined us today to be part of this event. We are honored to have you all with us. I, Mrs. Gopamma, Assistant Lecturer, Fundamentals of Nursing Department, privileged to welcome all of you to this event. World Hepatitis Day is observed every year on 28th July, bringing the world together under a single theme to raise awareness of the global burden of viral hepatitis and to influence real change. The theme for this year is Hepatitis Can't Wait. The date of 28th July was chosen because it is the birthday of Nobel Prize winning scientist Dr. Bruce Blumberg, who discovered hepatitis B virus and developed a diagnostic test and vaccine for this virus. Stop running away from hepatitis, which is base truth of life and a major concern of the whole world. Let us learn to protect ourselves from hepatitis diseases on World Hepatitis Day. World Hepatitis Day is an occasion that reminds us to stay aware and informed about the disease of hepatitis. Prayer is the song of the heart. It reaches the ear of the God even if it is mingled with the cry and tumult of thousand men. Let us invoke God's presence, happiness and peace for the success of this day through a prayer song.
हे मालिक तेरी दुनिया में है हमको तेरा ही आसरा। हे मालिक तेरी दुनिया में है हमको तेरा ही आसरा। मन धरता है बुझ जाए ना ये सांसों का छोटा सा दिया। जब आती हो हवाएं सहमी हो सारी दिशाएं, जब दुख की हो घटाए तो हम जाए कहाँ। हे मालिक तेरी दुनिया में है हमको तेरा ही आसरा।
Dear delegates and students, welcoming someone into our presence is the greatest virtue of all. A smile is universal welcome. With this smile, I take this opportunity to welcome each and every one of you. A leader is one who lights the path to the impossible and takes those who follow to great heights. It is an injustice to proceed to event without calling upon our wings of flight, our pillar of strength, and our constant source of motive. We cordially invite our respected principal, Dr. Larissa Martha Sams, whose endless efforts has resulted in great success of this institution, welcoming you, madam. I extend a very warm and hearty welcome to our beloved Dr. Teresa L. Mendonça, Vice Principal, Lakshmi Memorial College of Nursing. The more you take responsibility of your past and present, the more you are able to create future you seek. It is my turn to extend a gracious and inclusive welcome to our respected Dr. Diana Lobo, HOD Fundamentals of Nursing. It is your sense of commitment which creates as apt platform for us to grow both mentally and spiritually. On this great morning, with merging of minds, we welcome you, dear madam. A warm welcome to all the teaching faculty of Lakshmi Memorial College of Nursing, and also I would like to welcome all participants of various colleges who are present for today's event. I also extend a warm welcome to all participants for today's event. Once again, I welcome you all. Darkness cannot drive out darkness, only light can do that. Hate cannot drive out hate, only love can do that, said by Martin Luther King. As we light the lamp, may I call upon Dr. Larissa Martha Sams, Principal, Dr. Diana Lobo, HOD of Fundamentals of Nursing, forward to light the ceremonial lamp. Thank you all. One tree can start a forest. One word can frame a goal. One candle can wipe out darkness. A true leader has a confidence to stand alone. The quote above said is very much fitting to our beloved principal, Dr. Larissa Martha Sams. Your endless care, guidance, and support prove that you are a great leader. Dear Madam, we kindly request you to enrich us with your words of wisdom.
Good morning to one and all. It is indeed a great day that we have all come together to observe this International World Hepatitis Day 2021. All of us are aware from the first year of our nursing studies, be it BSc nursing or general nursing, that hepatitis vaccine is one of the things that we need to take before we could go to our clinical posting. That indicates that how important the hepatitis is in the life of any of the health professional, especially the nurses who are day in and out taking care of the patients from the day one that they are entering into the nursing profession. So if you see to the significance of the hepatitis in the clinical area, we could see that the patients or the health personnel who are affected with it are prone to get the infections of the liver and also hepatocellular carcinomas, which is the most severe form. So that is the most important public health problem that we need to curtail from the beginning. Anything which is prevented is better than later than we go for a curative measures. So in this regard, Lakshmi Memorial College of Nursing, the Department of Nursing Foundation, and the first year BSc Nursing and the general nursing students thought that it is apt that all the first year students of the nursing could gain some knowledge so that they could practice in their clinical area how we can prevent and control this hepatitis I think all of you are aware that we have A, B, C, D, E hepatitis. The most prevalent is the B and C, which is really a life threatening. So I wish all the participants all the best, and the panel discussion, the panelists also all the best. Have a good day. Thank you.
Thank you, madam. Before we head on with these sessions, participant kindly note the following instruction. Here we have our first year BSc and GNM students to enlighten us about various aspects of hepatitis through panel discussion. If you have any queries, to be posted in the chat box. Over to you, dear students.
Good day to everyone. I am Merlin Sarah Matthew, first year BSc Nursing student of Lakshmi Memorial College of Nursing. I am the moderator for today's panel discussion on hepatitis. World Hepatitis is recognized annually on 28th July, the birthday of Dr. Baruch Blumberg. Dr. Blumberg discovered hepatitis virus in 1967, and 2 years later, he developed the first hepatitis B vaccine. These achievements culminated in Dr. Blumberg winning the Nobel Prize. It is a day to work for global change to eliminate viral hepatitis and the suffering, death, and discrimination that accompanies hepatitis B and C by 2030. This year, it's the 11th official World Hepatitis Day. Organizations around the world commemorate this day to raise awareness of the problem of viral hepatitis. It brings the world under a single theme to influence a real change. This year's theme is Hepatitis Cannot Wait, and it is conveying the urgency of efforts needed to eliminate hepatitis as a public threat by 2030, with a person dying every 30 seconds from a hepatitis related illness. Even in the current COVID 19 crisis, we cannot wait to act on viral hepatitis. We need to quickly learn lessons and adapt our response. The race towards 2030 to eliminate viral hepatitis is on. If we lose focus now, the progress will plateau and there is a risk of resurgence. So, without any further delay, let's begin today's panel discussion by introducing our dear panelists present over here. We have Mr. Nahid KU of first year BSc Nursing of Lakshmi Memorial College of Nursing, Ms. Soni D'Souza of first year BSc Nursing of Lakshmi Memorial College of Nursing, Ms. Ria Binu of first year GNM of Lakshmi Memorial College of Nursing, Ms. Shraddha George of first year GNM of Lakshmi Memorial College of Nursing. So first of all, let's have an idea about what is hepatitis, how it spreads, what are the incubation period of each types and their signs and symptoms. To explain this, I would like to call upon Ms. Soni. I think there is some network issue in Sony's place. So moving on to the next question. So that is, so Mr. Nahid, tell us about the diagnostic measures which are
Yes,
currently
so
available
I
now.
think I think Sony is there. Sony is there. She has joined back. You can start with Sony, I think. Sony, are you there? Okay, let us wait for some more time. Sony will join soon. Sony can start.
First of all, good morning to all of you present over here. It's my pleasure to answer this question in front of you all. So basically, hepatitis is the inflammation of the liver. Hepatitis can be an acute, that is short-term infection, or a chronic, that is long-term infection. Some types of hepatitis can be acute infection, or other types can be both acute and chronic infection. There are different types of hepatitis with different causes. In that, viral hepatitis is the most common type. It is caused by several viruses like hepatitis virus A, B, C, D, and E. Alcoholic hepatitis is caused by heavy alcohol use. Toxic hepatitis can be caused as a secondary result of medications, drugs, toxins, or other supplements. Autoimmune hepatitis is a chronic type in which your body's immune system attacks your liver. The cause for this is not known, but genetics and your environment might play a major role. Now let's move on to each type of viral hepatitis on detail. Let's begin with hepatitis A. Hepatitis A is caused by an infection with the hepatitis A virus. It mainly spreads through eating contaminated food or drinking contaminated water. This disease is common in countries with the lack of safe water and poor sanitation. Now, let me tell you all about the incubation period of hepatitis A. Before that, what is incubation period? The period exposure to an infection and the appearance of the first symptom is known as incubation period. So the incubation period of hepatitis A is approximately 28 days. It may also range from 15 to 50 days. So the signs and symptoms of hepatitis A include fever, fatigue, nausea, abdominal pain, loss of appetite, dark urine, and jaundice. Clinical illness usually does not last longer than 2 months, although 10% to 15% of the people have prolonged signs and symptoms up to 6 months. Now let's have some idea about the second variant, that is hepatitis B. Hepatitis B is transmitted through contact with blood or other blood fluids with an infected person. For example, it can spread from mother to a child during childbirth, through sharing razors, having unprotected sex, and sharing needles and syringes to inject the drugs. These practices may increase your risk of getting hepatitis B. So the incubation period of hepatitis B virus is 90 days on an average, but it can also vary from 45 to 180 days. So the signs and symptoms of acute illness last several weeks, including the same symptoms that of hepatitis A. But acute hepatitis B can develop acute liver failure, which may lead to death. In some people, the hepatitis B virus can also cause a chronic liver infection that can later develop into liver cirrhosis or liver cancer. Moving on to the hepatitis C. Here we can find that hepatitis C spreads through blood to blood contact. That is, when one person comes in contact with the blood of the another person who has already hepatitis C virus. The most common modes of infection include unsafe injection practices, using unsterile medical equipment, and by using unscreened blood and blood products. It may also transmit it through certain sexual practice where blood is involved. It is more likely to spread if there is the presence of HIV or other sexually transmitted infection. The incubation period for hepatitis C ranges from 2 weeks to 6 months. Following initial infection, Approximately 80% of the people do not exhibit any symptoms. Those who are acutely symptomatic may exhibit same symptoms like hepatitis A and B, but in some persons, we may also observe the symptoms like joint pain, confusion, drowsiness, slurred speech, and swelling in legs. Now let's have one more overview on the another variant, that is hepatitis D. Hepatitis D is passed on through contact with the infected person. Unlike other forms, hepatitis D can't be contracted on its own. It can only infect people who are already infected with hepatitis B virus. So the incubation period for hepatitis D infection is approximately 2 to 8 weeks. But when hepatitis B and D viruses infect simultaneously, the incubation period is similar to that of hepatitis B virus, that is 45 to 180 days, and with an average of 90 days. The signs and symptoms for all the viral hepatitis is almost the same. So hepatitis D exhibit the same symptoms that of hepatitis A, B, and C. Last but not the least, let's end with an overview on hepatitis E. Hepatitis E mainly spreads through eating contaminated food or drinking contaminated water. Outbreaks generally occur when there is lack of safe water and poor sanitation. The incubation period for hepatitis E virus ranges from 2 weeks to 10 weeks, with an average of 5 to 6 weeks. The signs and symptoms of hepatitis E is also same like other hepatitis viruses, but here we can also observe the initial phase of mild fever, itching, skin rash, and slightly enlarged liver. Acute hepatitis E can be severe and result in acute liver failure leading to death. Thank you.
Thank you, Miss Soni. You have beautifully explained everything about the various types of hepatitis. I hope you all have got that. Let's have a walk through what she has discussed. There are five different types of viral hepatitis: hepatitis A, B, C, D, and E. Then she explained about how it spreads. Hepatitis A and hepatitis E through contaminated food or water. Hepatitis B, C, and D through blood to blood contact. Moving on to incubation period. For hepatitis A, it's 28 days. Hepatitis B, 90 days. Hepatitis C, 2 weeks to 6 months. Hepatitis D, 90 days. Hepatitis E, 5 to 6 weeks. We can summarize the signs and symptoms of majority of viral hepatitis into 7 categories: fever, fatigue, nausea, abdominal pain, loss of appetite, dark urine, and jaundice. Since we know the signs and symptoms, the next step is to diagnose which type of hepatitis is it. So, Mr. Nahid, tell us about the diagnostic measures which are currently available now.
Thank you, Merlin, for asking this question. First of all, hi everyone, a warm morning to one and all. Before dealing with diagnostic measures, I would like to give an idea about certain tests and some basic things. The first one is antibody. It is also known as an immunoglobulin. It is large, white-shaped protein used by immune system to identify and neutralize foreign objects such as pathogenic bacteria and viruses. The antibody recognizes a unique molecule of the pathogen called an antigen. And second one is antigen. It is a substance which introduced into a host induces antibody production and also react with the antibody in a specific and observed manner. And the third one is serological test. It is an antibody test that looks for the presence of antibodies, which are specific proteins made in response to infection. And the fourth one is liver function test. It is a group of tests that checks the levels of certain enzymes and other proteins in your blood. And the fifth one is liver ultrasound. It is a test that helps to check the liver blood flow in the portal and hepatic veins, and it helps to know the liver's tissue functionality. And the sixth one is transient elastography. It is a non-invasive method for the assessment of hepatic fibrosis in patients with chronic disease by measuring liver stiffness. It can also show the amount of liver damage. And the seventh one is real-time polymerase chain reaction, that is RT-PCR. It is commonly used to measure gene expression. And the eighth one is nested reverse transcription PCR. It is used to amplify genes present in low abundance. And the last one is assay, which will be detectable in the body before antibodies form. And next one is genotype test. It is used to determine the DNA sequence. So now let's move to the diagnostic measures. For hepatitis A, first one is serological test, and second, current molecular assay is based on nested reverse transcription PCR and real-time PCR. For hepatitis B, first one is blood test. It is to determine the immune system, and the second one is liver ultrasound. For hepatitis C, antibody test is first, and second one is RNA test, and the third one is genotype test. For hepatitis D, first of all, liver function test, and second one is blood test. It is to detect anti-hepatitis D antibodies. And last, for hepatitis E, blood test. It is to detect IgM antibodies. So that's all about the diagnostic measures. Thank you.
Yes, thank you, Mr. Nahid. He has briefly explained about the various diagnostic measures by giving us first an idea about various tests, including first one that is serological test, which is an antibody detection test. Second one, liver function test, which is in fact a group of tests that checks levels of certain enzymes and proteins. The third one is liver ultrasound, which helps to know the liver tissue functionality. Fourth one is transient elastography that measures liver stiffness. Fifth one is nested reverse transcription PCR, which amplifies genes present in low abundance. Sixth one is real-time polymerase chain reaction, which we call as RT-PCR, to measure gene expression. He also mentioned about what all tests are required for each viral hepatitis to get detected. So once diagnosed, we have to start the treatment. So Miss Ria, what all treatments are currently available now?
Good morning, everyone. First of all, thank you, Merlin, for asking me this question. I would like to answer to this question even. Each and every day that we pass through, if we observe any minute thing, we ask with our parents, what is it, how it is made up of, and many such things. Same way, if a person comes across with any kind of disease, he will surely ask with the same question, what is it, how it had become, what's the reason behind this, and finally, how can it be solved. Same way for hepatitis, there are solutions through treatment and prevention. So I will be saying treatment for each hepatitis one by one. Treatment for hepatitis A. There is no medical treatment available to treat the virus. Long recommended rest is preferred and avoid alcohol. Symptoms of hepatitis A can be relieved to some extent with rest and healthy diet. Now, people who have close contact or come in close contact with someone who has hepatitis A should receive normal human immunoglobulin within 2 weeks of exposure. Hepatitis A can be given at the same time as the immunoglobulin. What you should do during the treatment: eat fruits and vegetables, avoid food of high amount of fat, clean the toilet before and after with disinfectant. You should also avoid taking large number of medication because at that time your liver will be very weak and it can affect by medicine. So you should discuss any medication with your doctor before taking it to help you. Pay attention to your hygiene and pay attention to not to affect others by your virus. Now for hepatitis B. This disease can be prevented by vaccine against hepatitis B. Infection can be prevented by getting vaccine and HBIG soon after coming in contact with the virus. Now, what all things or what all awareness you have to look for hepatitis B? Avoid sharing needles or items such as toothbrushes or razors with an infected person. If you have not been vaccinated, it is best to use condoms after sex. You should also avoid getting tattoos or body piercing from unlicensed facilities because they might use the contaminated needle. As we all know, for every disease there are two kinds of infection, acute and chronic. So here, for acute hepatitis B, there is no treatment. but they may require treatment to relieve symptoms. For chronic hepatitis B infection, it is treated with medication to keep virus under control and if possible by liver transplant. What if suppose emergency treatment comes? Emergency treatment can also be given soon after possible exposure to hepatitis B virus to stop an infection developing. That is, the dose of hepatitis B vaccine can offer immediate but short-term protection until the vaccine starts to take effect on it. The drugs slow the replication of virus and occasionally results in its clearance. Most importantly, they greatly reduce the risk of the complication that hepatitis B can cause, such as liver cirrhosis and liver cancer. Now, for hepatitis C, interferon-based therapy is currently the standard of care of patients with chronic HCV, and it has also proven that it is more effective in eliminating HCV. And it should also be considered for patients with chronic infection. The response rate is around 50%, but 50% of responders will lapse upon withdrawal of treatment. For acute hepatitis C, it includes alpha and beta interferon monotherapy. It significantly decreases the number of patients that become chronic carriers. Currently, there is no vaccination available for hepatitis C, but the researchers have made significant advance in the treatment for hepatitis C using direct acting antiviral medication. The choice of medication will depend to hepatitis C genotype. People with different hepatitis C genotype will respond differently to this treatment. But now, the difference between them is slowly disappearing as the cure rate with new drugs have approached 100%. But 90% of them, we can see that it can be cured within 3 to 6 months. Genotype for chronic infection or chronic hepatitis is if the interferon is there, then it can be given by shot delicately by 3 times a week. Does this treatment work? Yes, hepatitis C treatment works if the interferon is alone. 10 to 15% of chance of clearing interferon can be seen. For pegylated interferon, up to 40% of chance. If the pegylated interferon is with ribavirin, then 40 to 50% of chance. But the fact is that 75% of people living with hepatitis C do not know that they are infected with this virus. Now for hepatitis D. There is no specific treatment for hepatitis D. There is some indication that antiviral medication such as interferon or lamivirin is used to treat hepatitis B, which will also be used for the treatment of hepatitis D. Hepatitis D can be avoided by being vaccinated against hepatitis B. Now last, hepatitis E. There is no medical treatment for hepatitis E even. The aim of treatment to alleviate symptoms is through bed rest and fluid replacement. There is no vaccination, but at present it is commercially also unavailable. Vaccine can exist for prevention of hepatitis E. That's all about the treatment of hepatitis A, B, C, D, and E. Thank you.
Thank you, Ms. Riya. So, Ms. Riya has explained in detail about the treatments. Let's look at what she has explained. She said that hepatitis A and hepatitis C are curable. Hepatitis B, D, and E are not curable. Specific treatments are there for hepatitis B and C. There are treatments for hepatitis A, D, and E, but there are no specific treatments for them. For hepatitis A, she has explained about what we should do after exposure to the virus. For hepatitis B, there are two kinds of infection, that is acute and chronic. For chronic hepatitis B, there are medications to keep the virus under control and possible by liver transplant as well. Moving on to hepatitis C, the treatment is interferon-based therapy. For acute hepatitis C, there is alpha and beta interferon monotherapy. For hepatitis D, antiviral medications such as interferon or lamivudine used to treat hepatitis B will also work. For hepatitis E, there are some symptoms. There are some treatments to alleviate the symptoms. Unfortunately, we found that for majority of viral hepatitis variants, specific treatments are not discovered. But we all know one thing, that prevention is better than cure. So, Ms. Riya, how do we prevent ourselves from viral hepatitis?
Yes, Merlin. As you said, prevention is better than cure. So let's see some of the preventive measures of hepatitis. Some of the common preventive measures are washing hands well, getting vaccinated, sharing contaminated needles, use condom when you have sex. General preventions are use of gloves, protective garments, mask and eye protective, and disposable needle. Avoid drinking water of unknown purity, uncooked shelf, and uncooked fruits or vegetables. Improved sanitation is the most important measure, and personal hygiene is the most important one too. As we know, hepatitis A and B have vaccine. So the best way to prevent hepatitis A is to get a vaccine. For better prevention, vaccine can be given to those who are at increased risk of HPV infection, such as healthcare workers, because healthcare workers are at high risk of occupational exposure to many bloodborne diseases. And it is also one of the most transmissible infection, but also the only one that is preventable by infection too. It is necessary to wear PPE kit, that is personal protective equipment, to minimize the exposure to infectious microorganisms. For hepatitis C, screening of blood organ is necessary. Avoiding IV drug abuse can be prevented. If the test is done, it should be done with high sensitivity. As for hepatitis C, D, E, there are no vaccination. But the vaccine for hepatitis B will protect against hepatitis D virus. Thus, the prevention strategies of this disease is similar to those of many other than that of Black nation. So basically, if I have to conclude, I can say only one thing. What all we are doing, what all prevention we are taking right now in this pandemic, in this COVID, if we take care for every other diseases, I'm sure one day we can overcome every disease and make our country a disease-free country. That's all. Thank you.
Thank you, Ms. Ria. Well, Ms. Ria has given us an idea about the preventive measures against viral hepatitis. As she told, that vaccines are available for hepatitis A and hepatitis B. For hepatitis D, hepatitis B vaccine can also be used. Apart from this, we have to maintain personal hygiene always, especially the healthcare workers. For hepatitis A, vaccine consists of 2 doses spaced between 6 to 12 months. For hepatitis B, wear personal protective equipment, that is PPE, to minimize exposure. For hepatitis C, screening donor blood can also be done to prevent it. For hepatitis D, ensure safe drinking water and avoid undercooked food items. But still the problem persists even though there are diagnostic measures, prevention and treatments. Mr. Nahid, tell us about the problems which are happening globally all around the world because of viral hepatitis.
It's my pleasure to answer this question. From Asia to North America, on this day, people around the world raise awareness about viral hepatitis and advocate for better access to treatment and prevention programs and more effective government action. It's because 4,000 deaths are happening a day from viral hepatitis infection. This action is critical because for too long, global leaders have made the hepatitis a low priority. Viral hepatitis is a silent disease that causes no symptoms until it's too late, and many believed the hepatitis B vaccine would simply make the infection go away. Instead of global health organizations focused on other diseases such as HIV, tuberculosis, and malaria. HIV especially benefited from unprecedented efforts and donated resources to enable diagnosis and prevention of transmission and to provide treatment at low cost. Today, we need the same effort and resources to eradicate viral hepatitis, which kill an estimated 1.4 million each year. More people die from hepatitis annually than from HIV and tuberculosis combined. For example, between 5 to 20% of the 1 billion people living in sub-Saharan Africa have chronic hepatitis B. Despite this prevalence, there are no widespread screening, education, or prevention programs in Africa. The majority of people lucky enough to get screened and diagnosed for hepatitis B are often blood donors because there are no public health clinics that provide screening for viral hepatitis. In Asia and Africa, even when pregnant women are diagnosed with hepatitis B, their newborns are often not given that critical first vaccine dose within 12 hours of birth. that would break the mother to child hepatitis B infection cycle. The birth dose of the hepatitis B vaccines either too costly or simply unavailable. Perinatal infection, though preventable, continues to be a major source of chronic infection worldwide. Around the world, discrimination against people with hepatitis B persists. Many countries prohibit immigration and education or professional advancement to people with hepatitis B. Some are considered unmarriageable if they are infected. In many countries, people with hepatitis B cannot enlist or attend prestigious military academies if they have hepatitis B, even though they pose no health threat to fellow students and soldiers who are all required to be vaccinated against hepatitis B. Today, hepatitis B and C are the seventh leading cause of death around the world, and 240 million people have chronic hepatitis B. Despite the availability of an effective vaccine, the number of people living with hepatitis B virus is projected to remain at the current unacceptably high level for the next 40 to 50 years and cause 20 million deaths through 2030. So, these are the problems which are happening globally around the world because of the viral hepatitis. So, the time to act is now. Thank you.
Thank you, Mr. Nahid. Mr. Nahid has beautifully explained the burden that is present because of viral hepatitis. But I strongly believe that awareness is the first step to prevention. Unless there is a massive scale up in screening, diagnosis, and linkage to care, more people will become infected and lives will continue to be lost. So, Ms. Shraddha, how to spread awareness to the common people about this deadly disease?
Good morning to you all. First of all, I'm happy to answer this question. It's very important that to create awareness to the public. First, identify at the risk patient. Hepatitis A is mostly like to be found in people who have not been vaccinated or previously infected. A very young, most infection occur during early childhood. Living in area with poor sanitation or lack of safe drinking water, lives with infected persons, use drugs recreationally, have a sexual partner who has hepatitis A. Hepatitis B is mostly found to be in people who are sexually active but are not in monogamous long-term relationship, have HIV, have a close family member or mother with hepatitis B, live with someone who have hepatitis B, are men who have sex with a man, work in healthcare and may be exposed to blood or inject illicit drugs, have chronic kidney or liver diseases, oriented from travel to part of the world where hepatitis B is most common, such as Iceland, Asia, Africa, where the hepatitis B is most common, have tattoos that may be infected. And second most, encourage vaccination. Safe and effective vaccination exists for hepatitis A and B. The Center of Disease Control and Prevention, that is CDC, recommends the hepatitis A vaccine for children 1 year of age 9 and the hepatitis B vaccine for infants at birth. The hepatitis B vaccine series should be completed by 6 to 18 months of age. Currently, no vaccine exists for HCV. However, individual can reduce the risk of infection by avoiding activities that put them in contact with infected blood. In particularly, it is most to avoid the use of injected drugs. Third most, provide educational resources. There are a number of ways to go about spreading information through social medias, posters, talking to the patients, encouraging colleges to do the same. Don't slowly focus on the risk. Also explain why screening and vaccination are necessary and effective. There are so also educational resources for patient can take advantages of such as the CDS 5-minute hepatitis risk assignments. And we can get involved all through World Hepatitis Day takes place just once a year. You can get involved year round and help spread awareness through various means. The World Hepatitis Alien Officer campaign materials such as posters, social media's graphics, which you can use to spread the message. That is Twitter, Instagram, FB, posters, stories. We can spread the awareness to the world. That's all. Thank you.
Thank you, Ms. Shraddha. Well, Ms. Shraddha has given us the steps to create awareness. As she has said, the awareness program should include first one that is identifying at-risk patients, second one that is encouraging vaccination, third one that is providing educational resources, and most importantly, getting involved. Apart from this, because of these awareness programs only, price reductions have made hepatitis C treatment an affordable, high impact intervention. But still, more awareness programs are needed to make it accessible to even the poorest of poor. Also, it says that HBV and HCV elimination will save millions of lives and advance commitments to global developmental goals. Ms. Shraddha, what are your views on the health impact of hepatitis elimination?
As Merlin, impact on society if we eradicate hepatitis from this world. Eliminating HPV and HCV as public health threats by 2030 would prevent approximately 36 million infections and save 10 million lives. Hepatitis elimination would also support progress towards the Sustainable Development Goals, particularly targets to the end poverty, good health, well-being, and reduce inequalities. Improving access to prevention and treatment services help protect patient against healthcare cost and productivity loss. This can help prevent patient from being pushed into poverty while saving future healthcare system resources. Elimination would help ensure healthy future for children, protect, empower, reduce stigma among marginalized population, and support protect commitments to HIV plus positive population, enhanced infection control services including blood safety, vaccination for health workers. It will improve quality standard in health system and reduce transmission of healthcare acquired illnesses for both patient and providers. And childhood vaccination ensure that newborn receive approximate postnatal care. Prevention of mother to child transmission, it can improve access to perinatal care, ensure healthy pregnancy, and promote institutional deliveries. Harm reduction effects will help to prevent the spread of blood-borne viruses such as HIV. That's all. Thank you.
Thank you, Ms. Shraddha. She has in fact briefly explained about how elimination would help ensure healthy futures for children, protect, empower, and reduce stigma among marginalized population. So now let's hear some facts about various types of viral hepatitis. I would like to begin with Ms. Shraddha for hepatitis A facts.
Some key facts of hepatitis A. Hepatitis A is a viral liver disease that can cause mild to severe illnesses. Almost everyone recover fully from hepatitis A with a lifelong immunity. Hepatitis A is very contagious and people can even spread the viruses before they feel illnesses. Especially hepatitis A found in Africa, Asia, Central and South America and Middle East. But in case safe and effective vaccination exists for hepatitis A and B. Thank you.
Thank you, Ms. Shraddha. Mr. Nahid, share the facts on hepatitis B.
So the facts about hepatitis B are: first one, around 3 in 2 Asian Americans with hepatitis B don't know they are infected. 9 lakh deaths per year caused by hepatitis B virus infection. And third one is an estimated 8 lakh 50,000 people currently have hepatitis B. Fourth one is breastfeeding is safe as hepatitis virus cannot be transmitted to the baby through the breast milk. And the fifth one is the only way hepatitis can be spread is by coming into contact with blood, semen, and vaginal secretions. So that's all about the facts of hepatitis B. Thank you.
Thank you, Mr. Nahid. Ms. Soni, tell us some facts about hepatitis C.
Facts of hepatitis C. So, hepatitis C virus can survive outside the host body up to 3 weeks at room temperature. It is important to know that hepatitis C is mostly a silent pathology with no apparent sickness signs. And when the symptoms do appear, the disease is already advanced. Millions of people have hepatitis C, but most of the people don't know it as it is asymptomatic. Hepatitis C is the leading cause of liver cancer because 85% develop chronic infection and major cause for the end stage is liver disease. There is no preventive vaccine for hepatitis C. However, 95% of the patient with chronic hepatitis C can be cured by antiviral drugs within 3 months of the treatment. Hepatitis C is considered cured if the virus is completely gone from the body, that is, 3 months after you complete your treatment. Globally, an estimated 71 million people have chronic hepatitis C infection. Thank you.
Thank you, Ms. Soni. Ms. Riya Binu, tell us some facts about hepatitis D as well as hepatitis E.
Yes, the facts for hepatitis D are cases are fewer than 1 million in India. An estimated 12 million people worldwide have experienced HDV infection. Hepatitis D is also known as delta hepatitis. People can become infected with both hepatitis B and D virus at the same time, which is known as co-infection, or get hepatitis D after first being infected with hepatitis B. This is known as superinfection. Now, the facts of hepatitis E. Hepatitis E usually resolves on its own without the treatment. Global studies have estimated that there are 8.7 million people living with chronic HCV in India. It requires medical diagnosis. Experts guess that prevalence of chronic HCV infection in India is approx or somewhere around 1%. That's all about the facts for hepatitis D and E. Thank you.
Thank you, Ms. Riya. Now the floor is open to all. Please throw your questions. So one question which I have received is, what all should a woman expecting a baby do to prevent from getting infected by viral hepatitis? To answer this, I would like to call upon Mr. Nahid.
Thank you for the question, and it's my pleasure to answer this question. First of all, I would like to say that hepatitis B viral, that is HBV, infection is an important public health issue. Evidence show that a hepatitis B infection mother can pass her infection to her newborn baby. Babies were exposed to HBV early life have a much higher risk of the infection becoming chronic and have a high probability of developing complications such as liver cancer. First thing we need to know is what should we do while being pregnant? All pregnant women should get tested for hepatitis B infection during early pregnancy. And also ask your doctor or midwife to make this arrangement for you during antenatal care. And another thing we should know is that why is it necessary for hepatitis B test during pregnancy? Hepatitis B positive pregnant women can pass on their infection to their babies at birth or after birth. Knowing your status during pregnancy will enable your doctor or midwife to organize appropriate response for you and your newborn. And the next thing we need to know is how can how can we protect a baby if the pregnant have hepatitis B? First of all, ensure that your baby receives two vaccines immediately after delivery. The two vaccines are hepatitis B vaccine, that is first dose, and second dose is hepatitis B immunoglobulin, HBIG. If these two vaccines are administered within the first 12 hours of birth, the baby has more than 95% chance of being protected against hepatitis B infection. However, make sure the baby continues with the routine vaccination at child welfare clinic. Next thing that we have to note is what we should do after giving birth dose to the baby. The baby must have a blood test at 9 months of pregnancy so he or she is fully protected from the infection, and consult your doctor or midwife for assistance. So that's all the thing we should take care of while being pregnant, and thank you.
Thank you, Mr. Nahid. So the second question from the audience side is why is it important to raise awareness on hepatitis? For answering this, I would like to call upon Ms. Shraddha.
Thank you for asking me this question. I'm very happy to answer this question. Awareness rise means making people conscious about a problem or issue. You want to make a certain topic or issue more visible within a community. Awareness rise is very powerful because it educates people about topics which are new to them and encourage them to participate in bringing change. When coming to viral hepatitis, hepatitis can lead to liver failure and liver cancer, but infection is often silent and symptomless until the development of significant liver diseases, which can occur year after the infection. As such, infection frequently goes undetected. It is one of the leading cause of death worldwide, killing more than 1.3 million people every year. So, it is high time to create awareness on this topic. That's all. Thank you.
Thank you, Ms. Shraddha. So I hope there are no more questions left. I would like to thank all of you for making it a priority to be here today to recognize and acknowledge that hepatitis is among us and that collectively we have a responsibility to change attitudes and improve the opportunities for prevention, testing, and treatment. In a nutshell, as the theme says, hepatitis cannot wait. People living with hepatitis unaware cannot wait for testing and life saving treatments. Expectant mothers cannot wait for hepatitis screening and treatment. Newborn babies cannot wait for birth dose vaccination. People affected by hepatitis cannot wait to end stigma and discrimination. Community organizations coping with hepatitis cannot wait for greater investment. Decision makers cannot wait any longer to make hepatitis elimination a reality through political will and funding. Elimination of mother to child transmission of HIV, hepatitis B, syphilis, Chagas cannot wait. I appreciate the fact that Lakshmi Memorial College of Nursing has also put their efforts today through this panel discussion to spread the word to everyone to bring the issue on the limelight. It is my pleasure to be a part of this discussion as a moderator on this significant International Day. Let's join our hands for a hepatitis free future. Thank you all for attending this panel discussion. This is Merlin Sarah Matthew, moderator for today's panel discussion, signing off. Thank you.
Thank you, dear students. Now I request dear delegates to fill the feedback form. The link is in the chat box. Now I call upon Dr. Diana Lobo to announce the winners various competition held on the occasion of World Hepatitis Day.
A very good morning to one and all. First of all, I congratulate dear first year BSc and GNM students for an amazing panel discussion. You worked hard and you did it. Keep up the good work. I am proud of you. Self-belief and hard work will always earn you success. On behalf of observation of World Hepatitis Day 2021, we had organized e-poster competitions, quiz competition and video blog competition only for first year GNM and BSc students. We received very good response from all over India. We had around 17 posters, 12 video blogs and 9 teams for quiz competition. I congratulate all the participants of various competition for your creativity, interest and enthusiastic participation. Without further delay, I would like to announce the winners of various competition. Moving on to poster competition, the third place is backed by Miss Lakshmi Siva from Government Headquarters Hospital, Chennai. The second place goes to Miss Santhya S from Sri Venkateshwara Nursing College, Chennai. The first place is backed by Miss Anusha Sunny from Lakshmi Memorial Institute of Nursing, Mangalore. Video blog competition, the first place is backed by Miss Velisha Trina Lobo from Father Mullah College of Nursing, Mangalore. The second place is backed by Mr. Abhishek Tamilmat from Lakshmi Memorial College of Nursing, Mangalore. The third place is backed by Mr. Santosh Kumar, Venkateshwara Nursing College, Chennai. Moving on to quiz competition, although participants are aware about results, I would like to announce the names of winners to audience. The first place goes to Miss Santhya S and Miss Tamilvani R from Venkateshwara Nursing College, Chennai. The second place is backed by Miss Lenita Jyotika Pinto and Miss Irene Andrews from Lakshmi Memorial College of Nursing, Mangalore. The third place backed by Vidya Vinaya B and Miss Lekana GD from Suraksha College of Nursing, Mysore. Once again, I congratulate all the winners as well as the participants. All participants will be receiving participation certificates, and winners kindly send your account details for NEFT purpose to the same email ID which is mentioned on the brochure nursingfoundation@lmcn.in. Thank you once again.
Before winding up the program, we would like to thank each person who have supported and helped us to make this day a grand success. We would like to thank our management and principal, Dr. Larissa Martha Sams, for giving us a chance to observe this day, and also faculty of LMCN for supporting and guiding us all through the path. Last but not least, we would like to thank all the delegates for our for your support for making today's event a successful one. Now we will display best 5 posters and play best 2 videos.
In this video, I am going to speak about my role in the prevention of hepatitis. Every year on 28th of July, we celebrate World Hepatitis Day. And the theme of 2021 happens to be Hepatitis Can't Wait. But the real question is, why can't it wait? And why is there an urgency of efforts needed to prevent hepatitis? Hepatitis is an inflammatory condition of liver. Now, after listening to this, it doesn't look so serious. But with a person dying every 30 seconds from hepatitis related illness, even during the present COVID 19 crisis, we really can't wait to act on viral hepatitis. So, coming to my role in its prevention, I am a common individual and a student nurse. As a common individual, my prime role is to know what exactly is hepatitis, its causes, and its mode of infection. Once I get to know these things, I can explain it to others. But how? I can't go to a random person and say that hepatitis has 5 strains A, B, C, D, and E, out of which B and C are most common. The person next to me might get baffled. Instead, I can explain him in simple words as to how he can avoid hepatitis. He can avoid sharing needles, blood contact, maintain personal hygiene, and eat healthy. This way, he can prevent hepatitis. I can use social media as my prime weapon to spread real news, not fake news. Nowadays, social media has the power to deliver information, and when right information is reached to people, right things can happen. Now, coming to my role as a student nurse, as we all know, nurses always deal with body and blood fluids of the sick. One of my prime role would be to maintain personal hygiene and practice universal precautions. Now, let me give an example. As a student nurse, if I encounter a patient who looks modest and shows no signs of hepatitis, I can't assume that she is free from the disease. There are chances that she has the practice of drug abuse, has sex with multiple partners, and does not maintain personal hygiene. So, as a student nurse, I need to treat every patient equally. I need to wash my hands before and after every procedure and wear gloves whenever needed. Thus, I have to maintain my personal hygiene as well as the hygiene of the ward. Education of the patient regarding hepatitis related illness is very essential because most of the times patients themselves won't be aware of it. Prevention is better than cure, so we should take vaccine for hepatitis as well as encourage people to take hepatitis vaccine. Thus, we can prevent hepatitis to some extent. As a student nurse, my prime role would be to have adequate knowledge regarding hepatitis, show correct preventive behavior, and share my knowledge to the best of my ability. Thus, these will be some of my roles in the prevention of hepatitis. Thank you so much. In this video, I am going to
Hello guys, this is Abhishek. My test number is LCV1. My topic is my role in prevention of the hepatitis. Hepatitis is a virus which causes the damage of the liver cells, also causes the liver cancer, liver cirrhosis. Liver is a tissue or an organ which helps in the storage of the glucose and vitamins. Let's understand about hepatitis through a skit.
Good morning, doctor.
Yes, good morning.
My name is Deepak.
Okay, Deepak. I am Dr. Abhishek. What's your problem, Deepak?
Yes, doctor. I have fever and tiredness, and also have severe pain in my joints.
Okay. You have fever. From how many days you have?
So from past 5 days, 4 to 5 days, I have fever.
Okay. You have any traveling histories?
Yes, doctor. Before lockdown, I used to go to trekking with my friends.
Okay. You ate anything uncooked food like?
Yeah, I always eat in the hotels, on roadsides.
Okay.
I love junk food.
And you have joint pain. From how many days?
That's from past last 2 weeks.
Okay, it's a severe pain or a common pain?
It's like it was very common before 1 week. Now it's severe. I am very much struggling to walk.
Okay. Is there any color change in your skin?
I don't see it, but I guess there is a little slight changes.
Okay, Deepak. Show me your palm like this. Show me. Okay. Okay, your skin color is changed. Okay. Show me your eyes. Do like this and show me. Okay. Show me this side of the nail. Okay, Deepak. There is a yellowish color. Okay. You have yellowish color in all fingers.
Not in all fingers, but in some fingers.
Okay. The symptoms are similar to the jaundice. I will give a prescription.
Is there any issue, sir?
No.
Will it cause
First,
any
you do the blood test. Okay. After
doctor.
the report, mail me. Okay, Deepak. Bye.
I'll send you the report. Doctor, I'll send you all my reports
Okay.
to your mail ID.
I got your report. Deepak, you have hepatitis.
What, doctor? Hepatitis?
Yes, you have hepatitis.
Sir, will I die?
No. It's acute. Okay. Don't worry.
So, can it be cured, doctor?
Yeah. It can be cured. Okay. You have to come to my hospital. Okay. You have to admit.
Okay, doctor.
We will give the cure. You have to take some preventions at the home. Okay.
Doctor.
You have to maintain your personal hygiene. Like you do not share your razors, wash your hands frequently. After cure, you have to take the vaccination. You can prevent the hepatitis by making banners, posters, and making drawing on the walls of the individuals' area or social areas, and then making advertisements in the TV. As a nurse, we can give education to the patients and also individuals who are affecting more for this virus. And thank you for giving this golden opportunity to explain about the hepatitis.
Here we come to an end of today's program. Thank you. Have a good day.